So we have discussed four types of the necrosis. Now we come towards the fifth type of the necrosis, which is called fibrinide necrosis. So fibrinide necrosis is a special type of necrosis. It occur in autoimmune autoimmune diseases. For example, in type 2 and type 3 hypersensitivity. It is a special type of necrosis which occur usually in the autoimmune diseases. For example, type 2 and type 3 hypersensitivity reactions, in which there is antigen antibody antibody complex are formed, which deposited on the wall of vessels. Complex are formed, and these complex deposited on the wall of the vessels. Fibrinide necrosis, it also may appear in a severe hypertension or chronic hypertension. How it occur in a chronic hypertension? Now we will discuss it, that how it occur. So in chronic hypertension, what causes fibrinide necrosis? It causes the fibrinide necrosis in the cortical arteries, due to which what happened? Weakening of the arterial wall occur. Weakening of arterial wall occur. As a result, there is a formation of small pouches. There is a formation of small pouches called aneurysmal out pouches. In a chronic hypertension, the fibrinide necrosis causes in the cortical arteries, which as a result of it, the arterial wall, they become weakened, and as a result, small pouches are formed, which are called aneurysmal out patches. And these aneurysmal out patches are also called Charcot-Bouchard microaneurysm. So this is how the chronic hypertension causes fibrinide necrosis. So now we will discuss about the example of the fibrinide necrosis, that where it occur. So fibrinide necrosis may also occur in a disease called polyarthritis nodosa. It occur in a disease called polyarthritis nodosa. It also occur in a scaph nodule, and it may also occur in a, as we have discussed, malignant hypertension. So this is all about the fibrinide necrosis. Till now we have discussed 5 types of the necrosis. Now we come towards the last type of the necrosis, and that is a gangrenous necrosis. Now we will discuss it in detail. So gangrenous necrosis, it is a not distinctive pattern of the dead cells, distinctive pattern of dead cell. So gangrenous necrosis, it is a clinical term that is applied, it is a clinical term that is applied, where it is applied whenever there is a limb involved, particularly lower limb. So what happened here? Here occurred the loss of blood supply to the limb, and inside the limbs a coagulative necrosis occur. What happened here? Loss of blood to the limb occur, and as a result, what occur inside the limb? Coagulative necrosis. If the bacterial infection is superimposed, if the bacterial infection is superimposed, what happened then? Then it can cause, or the morphological appearance may changes, and a liquefactive necrosis may occur. What it cause? Morphological changes may occur. Morphological changes may occur, and as a result, a liquefactive necrosis may occur. So it is a clinical term that is used whenever there is a limb involved, especially the lower limb. Also, the sepsis or septic shock, also the sepsis or septic shock can occur due to bacteria when it enter to the blood. It occur by bacteria when it enter into the blood. Now we will know about the wet gangrene, that what is wet gangrene. So it is a combination of coagulative necrosis, it is a combination of coagulative plus liquefactive necrosis. Example where we can see it, we can see the wet gangrene inside the diabetic foot. What happened in a diabetic foot? Usually ulcers formed on foot of diabetic patient. So this was all about the gangrenous necrosis, that it is a clinical term that is used whenever there is a limb involved. So till now we have discussed all the 6 type of the necrosis. Now I have to discuss a little bit a clinical correlate, that through which we will find out that how we will find that the cells or the tissue or the organ that is injured, due to which the necrosis occur. So these are the, you can say, the markers which are used to identify whether the tissue is injured or not. So for example, in heart attack or in myocardial infarction, heart attack or in myocardial infarction, what we can see, so heart contain an enzyme which is called troponin and creatine kinase. These are the enzymes that are present inside the heart. What happened to it, we will discuss a little after some time. Now in hepatocytes, we have transaminases. In hepatocytes we have transaminases. In bile duct, in bile duct we have alkaline, we have alkaline phosphatases, we have alkaline phosphatases. So what we do, we collect the serum from these patients. If the level of these enzyme is high, it will be considered as a damaged tissue because the cells are die, due to which the leakage of the enzymes occurs. So these are the markers that are used to identify whether the tissue is injured or not. When the concentration of these enzymes is high inside the serum, so we consider that inside the heart or inside the liver or inside the gallbladder there is an infections. So this was all about the necrosis. We have discussed about the necrosis, the changes inside the cytoplasm, inside the nucleus. After that we discussed the 6 type of the necrosis, and we also give a clinical correlate about the necrosis. So if you are new on our channel, so subscribe our channels. Thank you so much.